Hey y'all, this is Sarah, and I'm doing my master's project on non-small cell lung cancer. I chose this topic because I feel like lung cancer is a very big problem in today's society, especially since smoking and vaping has significantly increased because of such easy access to them. There are two types of subgroups of lung cancer, and I specifically chose non-small cell lung cancer because it is the most common type of lung cancer, and I'll talk more about that later. During this presentation, I'll discuss the general features, types, screenings, clinical assessment, diagnosis, and treatment of non-small cell lung cancer. So, lung cancer is one of the most common causes of cancer death, and that's mainly due to the late diagnosis of lung cancer. And so, what that means is by the time a patient is diagnosed with lung cancer, it's already in the advanced stages. And because of that, that's why lung cancer has really low survival rates compared to any other malignancies in the United States. And there are multiple risk factors as to why someone might develop lung cancer, with smoking being the biggest risk factor. Other risk factors can include exposure to hazardous materials such as asbestos, and then exposure to environmental pollutants or just genetics. So, lung cancer is divided into two subgroups: small cell lung cancer, which accounts for 10 to 15%, and then non small cell lung cancer, which accounts for 80 to 85%. Within non small cell lung cancer, it's divided into three additional subgroups: adenocarcinoma, which is the most common one, squamous cell lung cancer, and large cell carcinoma. So, for adenocarcinoma, like I said, is the most common type of non-small cell lung cancer, and it's usually located in the periphery of the lungs, and it's most commonly associated with women and non-smokers. Whereas squamous cell lung cancer is usually located centrally in the lungs, and it's also associated with hyperparathyroidism, which can lead to hypercalcemia. And then for large cell carcinoma, it can be found either in the periphery or centrally of the lungs. It's known to be the most aggressive non-small cell lung cancer. It has a very poor prognosis, and it's usually a diagnosis of exclusion. For lung cancer screenings, we usually follow the USPSTF screening guidelines for lung cancer, and the guidelines recommend annual lung cancer screenings using low-dose CT for patients between the ages 50 to 80 years old who have a 20 or greater pack year smoking history, and they're current smokers or have quit within the past 15 years. So the picture on the very bottom of this page shows what a CT scanner looks like, in case you didn't know what it looks like. And then the picture above that shows a patient who most likely has lung cancer within the left lung. So this slide shows signs and symptoms and physical exams that may indicate lung cancer. So common constitutional symptoms may include weight loss, generalized weakness, fever. The patient can also have chest pain, cough, hemoptysis, which means coughing up blood. And on physical exam, they may have dullness to percussion, where the lung cancer is located in their lungs. They also may have decreased breath sounds and digital clubbing, which is usually found in later stages. And the digital clubbing is usually due to the chronic hypoxia due to the lung cancer. To help us diagnose non-small cell lung cancer, we can get a couple things, such as labs, imaging, and biopsy, with biopsy being the gold standard. So for lab work, we can get things like a CBC or electrolytes, calcium, alk phos, or even a creatinine. Lab work lets us know if the lung cancer is causing any other problems. Like we discussed earlier, it can cause hypercalcemia and squamous cell carcinoma, and this would be due to an increase in parathyroid hormone. And then for imaging, a lot of time lung cancer is found incidentally on chest x-ray, and if it is found incidentally on chest x-ray, then a CT with contrast is usually used to determine the location and extent. And then we may further get a PET scan to determine if there are any mets or anything. And then, like I said, biopsy is the gold standard, It's best at confirming cancer and identifying the subtype of lung cancer. So for the treatment of non-small cell lung cancer, and just lung cancer in general, the biggest thing that can help them with the prognosis of active lung cancer is for them to quit smoking. That is the biggest thing, is for them to stop smoking if they are smokers. Other than that, there are other treatments available such as surgery, chemo, radiation, etc. But there are many factors that go into coming up with a treatment plan, such as the stage of the lung cancer, the histology, the patient's condition, whether they're able to tolerate any of the treatments, any genetic alterations, or anything like that. And then for prevention of lung cancer, the biggest thing would be to avoid smoking. These are my references that I used for my master's project. I'd like to take the time to say thank you for watching my video, and I hope that y'all learned something and or reinforce a knowledge y'all may have already had. And if you have any questions, please let me know. Thank you again.